This is Michael Rawlings. He has spent time in the U.S. Air Force, pardon me, I hope I get this right, and years working in social services as a fraud investigator and for the city of Richmond. And he is going to talk to us today about COVID vaccine access for Black, Indigenous, and people of color with disabilities.
Okay, am I on? Is it my time?
It is your time.
Okay, there it is. Hello, everybody. Again, my name is Michael Rawlings. I'm the Chief Operations Officer with Capital Area Health Network. And first, let me say that I appreciate the opportunity to speak with you all today. Hopefully, you can gain some insight of what I'm about to say. And obviously, towards the end of the presentation, if anyone has any type of questions, we'll take those. But during my time, feel free to stop me if you really need to, and I'll answer questions at that particular time, because I really like to stay in topic. So when I change to something else, I'm kind of over there. But I will take questions again at the very end. So the first thing I'd like to say, Capital Area Health Network, you'll kind of hear me call out our acronym CON. So that's kind of what we go by, and most people in the community speak of us in that nature. So let me tell you a little bit about us before we really get deeper into the conversation. So first of all, CON is designated as a FQHC, which is a federally qualified community health center. Okay, we serve under the Health Resources and Services Administration, which is HRSA, if you heard anything of that through the federal government. And it is through this type of designation that we're able to partner with the federal government and provide care for underserved individuals in our communities. Without this type of partnership, it would almost be impossible for us to serve the needy residents of our community. And so we do appreciate and cherish that opportunity. One of the things we want to make sure everyone is aware of, we also go by our values, and we say CON cares. Lots of acronyms when you talk to folks these days, but CON cares. CARE stands for compassion, accountability, reverence, excellence, and stewardship. But these are the type of values that we bring to our community, and we expect that all of our employees also kind of mimic and serve in that manner to all individuals in the community. Also, I think everybody should at least be aware of our history, because when I spoke with Kim and some of the others before, they were not even knowledgeable of CON. So I'm happy to have the opportunity to kind of talk to you a little bit about CON, what we do, why we're here, how we got here. So speaking of our history, we started out in Church Hill in a very small organization at that time. It's called the Vernon J. Harris East End Community Health Center, again, located in Church Hill in Richmond. And it was a Dr. Vernon J. Harris at that particular time, whose his thoughts and his desires were to serve those in the community that were underserved. Everybody didn't have, I would say, income, unemployed, the underemployed, the no income, limited income, what have you. And so if there were folks that had some level of economic distress, it was his desire to serve them. And so as we've come in now as Capital Area Health Network, we've taken that commitment to serve the underserved, certainly during these times. So we want to make sure that we provide quality health care to our patients. And so CON's committed to build upon the charge that Dr. Harris set back some time ago. And, you know, again, we provide healthcare services, we take referrals, we do preventive care, we do all of these type of things in the community to make sure that the community, the Richmond metropolitan community, is well taken care of. Our goal at the end of the day, the goal of CON is to eliminate health disparities, respond to diverse community needs, improve the quality of life for the medically underserved, and any of those that are experiencing barriers to care. We'll talk a little bit about that as we progress here. We also want to promote health equity by ensuring access and health literacy designed to empower our residents. So again, we'll talk some of the words that's part of our commitment is also a part of this presentation today, and a little bit of what was asked of from me. So we'll continue to dedicate ourselves to collaborating with human support services, with the health departments, other government agencies, foundations, local physicians, schools, etc., in order to get the healthcare out to everyone and make sure that everyone is supported. Again, we are a nonprofit health organization. Our mission is to provide high quality, accessible, and culturally responsive healthcare in order to improve the health status of the residents of the Richmond metropolitan area. And our services include mental health, HIV and PrEP services, as well as our medical and dental care. So, sorry, so what we're here to talk about is access. So we want to talk about access, and in particular, the COVID vaccine access, and then participation among the Black and Indigenous people of color with disabilities. So if you just take a quick gander at this photo I have behind me, let me kind of disappear for a minute. I'm back. But anyway, what you see behind me, and I'm gonna show another picture here shortly, that's our mobile unit. So our mobile unit is part of eliminating barriers because folks need healthcare. And that mobile unit, which has 2 medical exam rooms and 1 dental exam room, we can go where when the people can't come to us, we can go to them. So that's one of the easiest ways that I can think of making, I would say, healthcare and the COVID vaccine itself accessible. So the second thing that we have making those things accessible, again, the COVID vaccine, if I stay in that vein, we've also purchased a shed, 14 by 12 shed that we've actually customized, and we now lovingly call that today the Vac Shack. So folks come there in the morning from 9 to 12. We do COVID testing. And then in the afternoon, I think it starts at 2 o'clock. From 2 o'clock to 5 o'clock, we provide COVID vaccines. That's also located at our Vernon J. Harris Health Center, 719 25th Street in Richmond, in Churchill area. So we make that available pretty much on a daily basis so folks can either get tested or actually receive the vaccine on site. So we've partnered with several churches in the area. We partnered with some of the flea markets in the area. We've been to the Indian health reservations in the area, and not just in the Richmond metropolitan area, but we've been pretty much across the state. So I traveled with a group. We went to Buena Vista and out there to Perry McClure High School, and that's on the western part of the state. We've been down to Suffolk and Smithfield area and Isle of Wight. So we went there with our mobile unit to provide COVID services, again, testing as well as vaccine, because I think both of those things have been very important at this stage. So those are the things that we've kind of done here, I would say, in close proximity of this, of our sites. We have 6 sites. We have them on both sides of the river. So we're at south of the river over at Bermuda Commons, which is up Jeff Davis Highway. We also have a site that we provide out in Hanover currently at Ashland Junction Shopping Center. So we're there a couple of days, and we actually go out there with our mobile unit to provide services. So I think we're trying to partner with as many community folks as we can to make sure that the vaccines are accessible. normally when we're out, we provide all 3 vaccines. And when I say we provide all 3, meaning that we have the Johnson & Johnson, the Pfizer, and the Moderna available. And to some degree, it's at the patient's request as to what vaccine that they receive. And obviously we can give children vaccines, but only to the age of 12, and they're only allowed to get the Pfizer right now. So, but we do make that accessible to those children as well. So I think I'm asking a lot, and I think what I would like to do at this point in time, Kim, if you would, just see if there are any general questions out there, because I think we're talking about access. I've seen a couple of questions kind of pop up in the chat. Is there something you can tell me there? But you're on mute, Kim. Kim, you're on mute. Okay.
All right, thank you.
Okay.
So one of the questions, and this is from Sim Winbush, she's asking if the communities of color have been receptive for CON coming to them to provide the vaccines.
Okay, absolutely. So primarily, as I speak of the places that we've been to, so again, we've served the Indian population. So it's been, I think, all, let me say, a number of different, from the Mattapanai, the 𝐲𝐿𝐻𝐿, as well as many others. I don't want to leave anyone out, but we served we've been on a number of Indian reservations, both in the Richmond, Hanover area, as well as on the outskirts of the state. Then we've also served the Latino communities. So at the flea market on Jeff Davis, I think we were out there. Part of our services in Ashland right now are kind of geared toward the Latino communities. And also right there where our facilities are. So the one at Northside, we've kind of serviced a lot of the inner city folks, so to speak. So that comes with a very diverse background. When you say inner city, you know, it's a very diverse population. So, so the answer to that question is absolutely yes. And so we actually travel to where the demand is at that particular point in time.
Okay. Okay, thank you.
I was looking at another question here. I thought I saw in the chat.
Yep. And so a follow-up question to that is, what has the response been to receiving the vaccine?
Well, you know, I think with the responses, there's been a mixed bag of the responses. I tell you that obviously from our facility, we've all been advocates for getting the vaccines. The Black community, I think I could probably safely say that 50% of our non-patients have kind of been vaccinated that have come to us, that we've reached out and talked to. So we haven't had the greatest turnout in that particular area, so to speak, because we don't always see them when we go to those communities. Obviously, we only can vaccinate those that actually show up to our sites. So, but when we're out just talking in general, trying to set that situation up, and we're asking who is receptive to vaccines. So when I say 50%, that half and half, so to speak, that's just in conversation. But at the end of the day, whoever shows up to get the vaccine, all of them get it. So if they didn't show up, I wouldn't necessarily know whether they showed up or not. Registrations, we do have people to register for our vaccines. And when they register, for the most part, that's been a pretty good turnout, because if they don't come when they're registered, a lot of times they call to reschedule. I would say the Black community is probably, I would say maybe 60% of our patient population. And so I would go on to say probably I think we're running roughly right there with the government, so to speak, in that 70-some percentile of the adults being vaccinated of our patient population.
Gotcha.
As far as where our mobile units set up, how we determine that, a lot of times, well, we have a request for services that we use, but a lot of times it's either word of mouth or a simple call to the organization. And if they call the organization about that, we just kind of try to get an idea of what the general amount of people would be. How many people would you guys expect to show up at an event? So we've been to events where people said, look, I think we're gonna have 100, maybe 150, maybe 200. And they're very excited about that. And then we come and we give about 15 or 20 vaccines out. So, but when we give one vaccine, it's been a great day because that's one more person is vaccinated. It kind of helps towards that, that overall percentage that we're trying to look for. So part of the conversation that I have with folks, and I guess I'll have it with you all that are here today, is that, you know, when you look back historically over vaccines, and I have this conversation with folks, when a lot of the disease have been eradicated, so to speak, or at least minimized, you know, it took a vaccine, yellow fever, it took a vaccine to kind of help get rid of that. It wasn't that it just went away, because actually it's still present today. Typhoid, had to get a vaccine in order to get rid of it. So a lot of these conversations I just have with folks in general when I try to be pro-vaccine. I am pro-vaccine. And when I share just some of the information that from some of my own research, I try to share that. So whether it makes a difference or not, I don't know. At the end of the day, each person will be responsible for his or her own decisions. And I'm very pro-vaccine because I think they work. I know there have been troubles on both sides of vaccines in the past, but we all have to grow. We have to grow from our thoughts and from our actions. So that was my soapbox for this part of the discussion. So, but anyway, I hope I answered the question about where the mobile unit sets up. So, but it varies. So we try to do events on the weekends primarily, mostly Saturdays. So we did a We Care event at one of the local elementary schools. That was not last, that was weekend before last. This past weekend, we did a church. On the 9th of October, we're going back to the flea market. So we've gotten a very good response from the Latino community over there. So we're giving anywhere from 50 to 100 vaccines over there on Saturdays when we arrive. On the 16th of October, we're going to be doing an event called Flocktoberfest, which is part of a local radio station that's kind of sponsoring that. So, so our events, our Saturdays fill up quite frequently. My staff kind of have problems with every Saturday working Monday through Friday, then have to work on a Saturday, but we have a common goal and we're working for the good of the people. And so we kind of get beyond, you know, some of the struggles of putting in lots of hours, because I think at the end of the day, if we can get this COVID matter behind us, everybody will feel a whole lot better. So that's pretty much the how the mobile unit works. And so when we set up at any event that we have, folks are certainly welcome to participate. They don't have to be part of that particular community. Drive through, walk up. The other thing I like to speak on is our back shack, since that operates on a daily basis for the most part. So we're averaging right now probably about 45 tests in the morning, and we're distributing about 15 vaccines in the afternoons. And so that's been pretty steady since we set that up. So that's been in operation since August. So we're moved our operations. We were working out of a grocery store for a while in order to meet the demand of the folks. So, but now we're trying this Vac Shack, and it's very receptive. It's kind of like a drive-up situation where folks can drive up. The nurse comes out, a little bit of conversation, quick registration, and we can do PCR or rapid tests at that particular time. And then obviously with the vaccines in the afternoon, again, we still have the 3 options that are available for whoever is participating. So we've been pretty happy with the success of that. So an investment well worthwhile. Let's see, it was one other thing that I wanted to mention to you guys here. That was a couple of things actually. So we have our patient portal, which we use for registration and information. So that's part of our communication process to get information out to our patients. So if our patients haven't been vaccinated, we were able to use that for a while to set them up for appointments and things of that nature. One of the other things that we do to communicate information to folks is we use Radio Poder, which I can't remember the call station just yet. I may be getting that any time now, but we use Radio Poder, which is in the Latino community. It's 1380 AM. So we do a broadcast every Wednesday at 4:30, and we also talk about vaccines and how they can access them and things of that nature. There are other local radio stations periodically announce our capabilities. And then we also use some print media as well to kind of advertise vaccines. So we're trying to make sure that the information is readily available to everyone in all different types of media. And like saying, and then more importantly, if that community can't come to us, we certainly can go out to that community. All right, I'm gonna go back to the chat here and see what else I have out here. Andrew, thanks for your question, Andrew. And his question went out to everyone, but how have you been able to help those who might be hesitant due to their immigration status? Well, I'll tell you in the Latino community, because first of all, the immigration status doesn't matter. So if you're here and you want to be vaccinated, you can be vaccinated. And let me tell you something else just about Capital Area Health Network in general. So, because that question has come up, we serve folks who do not have insurance. And so certainly someone without appropriate, without the immigration status, or what is called, at least in social services, as we call it, the undocumented versus the documented. But those who don't have the appropriate documentation, it doesn't matter at Capital Area Health Network. If you need to have medical services, what we do is we provide those medical services, and then it's income based. And so since we partner with the federal government, again, the Human Resource Services Administration, or HRSA, since we partner with them, they kind of grant us certain funding to kind of assist folks who are not insured, underinsured, or even in that immigration status. So if you have income, we kind of adjust that to a sliding scale. So my front desk staff and my billing personnel certainly know a lot more about that than I, but I know that they do it. So that's what happens there. So immigration status, not really a concern. If you need to have a vaccine, come get your vaccine. All right. And I think also, Andrew, with that question, I think we also discussed that very same thing on the radio station periodically. So I think my radio personality probably goes back to that question maybe about once a month. I don't think she wants to repeat it at every show, but she goes to that about once a month. And so I think that was a very good question. And but the goal of the government, the goal of the medical folks, the goal of the scientists is to get as many people vaccinated as possible so we can get this COVID situation behind us. And so, again, in the history of disease and things of that nature, it's always been a vaccine that has helped us, because without vaccines, we probably still have malaria around. Nobody catches malaria, or only a very small percentage now, but malaria has certainly been conquered. And we're probably not going to conquer COVID without vaccines. Does the public know if they have to show proof of insurance or immigration status? So proof of insurance is only required if you have insurance. So basically you just say you don't have insurance, because that certainly would be a question. I don't think the immigration question is status is a question, but they will ask about insurance. And at the end of the day, just I am uninsured. So I think they capture your name, uninsured, and then you are vaccinated. And so I would imagine they will capture some other information as well, but it has nothing to do with your immigration status. So great follow-up, someone.
You got it. All right, this is Kim, and I was just wondering, I put this in the chat, but do participants pre-register for the mobile events? And you might have already said this. How are the fees determined? And there may not be one.
Okay, there's no fee for
Okay.
the COVID vaccine currently. No, they do not have to be pre-registered for mobile events. We do try to pre-register because that kind of gives us an idea of the number of vaccines to carry when we're out. But if we don't get a number, we carry a certain amount. Excuse me, we carry a certain amount of vaccines, and then when they're gone, they're gone. So if we get a registry, if we get, let's say 50 to 75 people to register, maybe we'll bring 100 vaccines. If we get no registrations, maybe we'll only bring 50. So it just kind of depends. And then it depends on the type of event it is. So if we're going to an event that's a large scale event, so I think like the 2 Street Festival is coming to the Richmond area. So I don't think we're going to participate in that this year, but that would be a pretty large event. So we may have more vaccines if we were participating in that. When we go to the Jefferson Davis Flea Market, which we'll be going back to on the 9th, when we go there, we'll probably have somewhere around 50 to 75 vaccines, or 50 to 75 vaccines. And that would probably be like the Moderna. Then we'll probably have maybe like 25 Pfizer and maybe 25 J&J. So what we're finding right now is that Pfizer's kind of like the #1 choice right now, but we tend to use those a lot for kids because, again, that is the kid-approved one. And but Pfizer followed closely by Moderna. The J&J has been kind of falling back some, but honestly enough, it's actually been picking back up because it's only a one-shot situation. So you only have to get one shot in the J&J. And some of the scary information that was put out before has kind of waned now. So, you know, I mean, they're studying all of the vaccines as we progress. I will go on to say that even when there were issues with the J&J, it's like 0.0001%. But obviously, if you're at that 0.0001%, it means a whole lot to you. So that part everyone kind of understands. But the percentages, there are percentages in every vaccine and everything that you do. So we have to kind of learn to understand that, trust the science, and respect the doctors. That's what I say.
Yeah.
All right. Let's see. Any more questions out there? Did I miss anything?
I do not see anything else at the moment.
Okay. Okay. So, but 1380 a.m. One thing I do want to say, I didn't do this, but if you're interested in Capital Area Health Network as part of your healthcare system, 804-780-0840 is the number there, and then obviously you would end up having to go through some prompts as you get into that number. And then the other thing that some of you tech savvy persons out there, I got something else for you as well, and that would be our website. So some of the things that I talked to you about today are already posted on our website. We do kind of stay up with our website a little bit, and I know we have Facebook. They probably got some other things that I'm not involved with. Some of the technology, our IT, and our IT folks kind of take care of that. So, but yes, so we would love to be able to serve folks as your PCP, as your dental provider. If anyone has any mental health issues, we'll certainly look at those. I'll tell anybody also just about mental health as I cross into a different vein, so to speak. But mental health doesn't mean there's a problem. It's just like your regular physical. So you can check your body, you can get your mental checked as well, and everything is good. So don't be afraid to seek assistance in that. So I go for my physical health checks all the time, and I think I get my mental health checks every day when I come to work. So I speak to those mental health folks, and so I think they check me every day. So might there be any additional questions? And I thought about providing a PowerPoint for you guys, but I thought most of this would just kind of be conversational. I did want to give you a little bit of background information about Capital Area Health Network, because prior to working for the network, I knew very little about it. And then when I found out about it, I said, I wish I would have known about it a long time ago, because I known of a lot of folks that could have used the, by coming out of social services, honestly, I known a lot of folks that could have used the services that Capital Area Health Network provides. And so I look forward to servicing some of you guys, or at least my doctors and dentists, or what have you, that they'll take care of you and make sure you're in a good place. And if there are no additional questions, I would swear to you that I've talked about everything that I could. Kim, anything additional that you would have or you would ask at this point in time?
You can hear me?
Yes.
Okay. I guess, and I am sorry, I was a little late on the sound coming in. So if I'm making you repeat yourself, I apologize.
Oh, no problem.
What are your general locations? Do you have, I mean, I'm sure it's on your website, but.
Yeah, and I'm sorry, I just kind of mentioned South Side and north of the river. So, but I'll certainly do that. I didn't cover those. But anyway, we have a site at Bermuda Commons, which is on Jeff Davis Highway on the south side, just past the 150. We have Southside Medical Center, which is a little bit closer to the river, but that's on at Belvedere and Bainbridge, or Coward and Bainbridge. Name of that road changes every 5 feet or something, but that's at Coward and Bainbridge. We have a site, our hub, 719 North 25th Street, which is the Vernon J. Harris site. We also have the Northside Medical Center site, which is our corporate office, and also has pediatrics, primary care in that site. That's at 2809 North Avenue. Then we have the Greater Fulton Medical Center, which is on Williamsburg Road in the Fulton area. And then we also have a site posted on the campus of Virginia Union. So that site services Virginia Union students as well as the general public should they come to that site. So those sites are manned Monday through Friday. And all of our sites are Monday through Friday. We have no Saturday or Sunday hours. But on Saturdays, our mobile unit is kind of out in the community. And that's been the case pretty much since COVID. So since May of 2020, so to speak, that mobile unit has been running. Matter of fact, we had to buy a new one because we ran the old one into the ground. So the trailer is still good, but we ran the truck into the ground. So we bought a brand new 2021 Peterbilt tractor to carry that trailer around. And so, because we want to make sure that we can get out there to the public to service them in the way that they need to be served. And so what I did, just our trailer, as I kind of move out of the way a little bit in the distance, that's what our trailer looks like. And again, on that trailer, you would have 2 medical exam rooms and a dental exam room, an IT closet, a reception area, also, hey, it has a bathroom and all the other necessities, eye wash station. So it's a full service clinic. Wherever it goes, it actually has its own billing. That's how much of a clinic that it is. So it is registered as its own healthcare facility. Right. So yeah, we call that's our Con Health Express. So if an organization actually would like to have that unit kind of show up at your site, and we do some things during the week as well. We try not to have our folks work late into the night after working early in the morning. We try not to have them work late into the night and then turn back around and work on Saturdays. But we will provide some evening hours, so they overlap. So we're providing service for Richmond Public Schools, and that will be like a 2 o'clock to 6 o'clock service for them. So different vaccines though. So we provide vaccines for students other than the COVID stuff. So the Tdaps and meningococcal and all those other school age vaccines that kids need to have. So we provide those as well. Okay, now I really feel like I've covered the gamut. If there are no additional questions, I think there's a song that I might be able to sing if everybody can join in with me.